Good evening, and thank you for joining us here on blackdoctor.org. I am Ellis Dean, the Director of Digital Programming here at Black Doctor, and a familiar face that you see here every Tuesday as we do our Operation Life programming. And so this is a series where we take those illnesses and conditions that disproportionately affect Black and brown people around the world, and we break them down for you so you can be for a couple of reasons. The first reason is we want you to learn the most about anything that is ailing you or a family member. And so the more knowledge you can have about a particular illness or ailment, the better you are at being able to treat it and overcome it. The second thing is, and that helps you become your own best health advocate. So you can go into your doctor and be that and no more questions to ask, no more information, know what those numbers mean that they take when they draw the blood and they do all those numbers. We want you to be able to know it so you can ask the right questions to get the information that you need. And you can also take that information and share it with your friends and family, because ultimately we know that the life expectancy gap between Black and brown people, and the white majority is wide. And so we're trying to close that gap. We're trying to close the health disparities gap. We're trying to close all those gaps so we can live more healthy and more productive lives. So this is week 4 of our Operation Life Back to Basics series. We have tackled cholesterol, we have tackled hypertension, and we have tackled asthma and COPD. So if you want to go to blackdoctor.org, go to our YouTube page, and you can check out those previous programs. We've done wonderful programs. And tonight we are all about diabetes, AKA the sugar. And we all know what it is. We've talked about it. We talk about diabetes. And so tonight we have a wonderful guest. She is a friend to Black Doctor, and she knows everything about diabetes. And so we're going to have Dr. Lenore Coleman come on. So a couple of things I want you to do before we get started with Dr. Coleman is I want you to let us know where you're watching from. We always like to know where people are watching from all over the nation. Number 2, we want you to tag a friend and share this content. If there's somebody that needs this information, please let us share that, tag that person and share this content. And number 3, if you have a question, please put that in the comment section and we will ask Dr. Coleman while we have her for this hour. So I have talked her up. Welcome, Dr. Coleman. How are you doing this evening?
Thank you. Welcome. I'm so glad to be here this evening. And I always enjoy doing this show because I know it goes out to a lot of people. And that's really important because diabetes is affecting a lot of people. So I need to get the word out. So this is a great way for me to be able to do that.
Absolutely. So we're gonna get started right away. So first question is, what is diabetes?
Okay, so diabetes is a condition that actually runs in families. So it's genetic. So people don't know that, but it actually runs in family. If you have diabetes, then someone in your family before you had diabetes. You might not know who they were, but somebody did have it. And what diabetes is an inability of the body to keep your blood glucose or blood sugar levels under control, under normal levels. Okay, so then the question is, so what is the normal levels of blood sugar? And the normal levels of blood sugar are 60 to 100 milligrams per deciliter. That's mg/dl. So 60 to 100 milligrams per deciliter. So what happens is when we eat food, that food is broken down in your body into carbohydrates, which is your sugars and your starches. It's broken down into fats, and it's broken down into proteins. And there is a hormone called insulin that's secreted from the pancreas. And that insulin is what gets the blood sugar that when you consume your food, it gets those carbohydrates, that sugar that's produced out of the blood and inside the cells so that it can work, so that the cells of the brain and the heart and your legs and your muscles, all the cells throughout your body, for those cells to work efficiently, it needs glucose. It needs the sugar from the foods that we eat. So in diabetes, there are 2 types. There's type 1 diabetes and there's type 2 diabetes.
Okay.
In type 1 diabetes, that the insulin from your pancreas just stops coming out. You just become insulin deficient. It's gone. Usually happens when you're a child, usually between the ages of 10 and 14 years old. And because the pancreas stops secreting insulin, your blood sugar starts to rise. And so those patients, type 1 patients, have to actually inject insulin because their body doesn't have any.
Okay.
Type 2 diabetes, your body has plenty of insulin. In fact, your pancreas is working overtime producing insulin. You have something what we call hyperinsulinemia. So you have high circulating levels of insulin. That's bad because what insulin does is store fat. So when you see people that have diabetes and you wonder why they're so overweight, it's because they usually have a lot of circulating insulin in their body, but that insulin doesn't work correctly. So it doesn't open up the doors to your cells to let that sugar out of the blood inside the cell. So it just doesn't, if you think of it as a lock and key, the key doesn't fit the lock. To open up that door to the cell and let the sugar out of the blood and into the cell. And so these type 2 patients tend to have to usually take oral medications initially to help that pancreas and their body become more sensitive to the insulin that they have.
Okay.
But diabetes is a long-term disease. So over time, if you don't control your blood sugar, especially early on when you first get diagnosed, if you don't control it and get it down to as close to normal as possible, what happens is that later on, 5-10 years later, you're going to have to use insulin to get your blood sugar down.
Okay.
So a lot of people think they're type 1 just because they're on insulin, but they're not.
Okay. So we've got 2 types of diabetes. Just a recap. We've got 2 types of diabetes. Type 1 typically happens when you're younger and you just don't produce insulin. So you have to do insulin shots to give you insulin into your body, and the insulin is produced by the pancreas. Yes. So when you hear about somebody having pancreatic cancer, that's a whole other issue. But insulin is produced in the pancreas. Type 2 is when you've got too much insulin, but in your body, but the insulin is not working properly to open up the cells to allow that blood sugar when your body breaks down your food, and you need that blood sugar in your cells to give you energy and all that other stuff. Then if your insulin is not working properly, it doesn't open up the cells, doesn't allow the blood sugar to flow into the cells. And then therefore we just got overabundance of sugar floating around in our body. And then that converts to fat, and that leads to obesity, which could lead to obesity if it's not properly controlled. So that's
it. You know what? Come on over here. You can teach my classes. So you got it. Hey, that's it.
I've learned it. Okay, so we got that. Okay. Now, and you said that the normal level and we're talking about milliliters, is between 60 and 100 milligrams per deciliter. So that's a fancy way of saying, so when you go get your physical and they do that blood test, and they're going to check your blood sugar, and you say, hey, what's my blood sugar? This is where the normal range should be, right? Yeah.
Especially when you get up first thing in the morning and you haven't eaten anything, this is considered normal blood sugar. Yes.
Right, because your blood sugar will fluctuate once you eat, and so that's why it's always good to, especially if you're going to go get a physical. This is one of the reasons why they say don't eat in the morning before your physical, because you can change your blood sugar, you can change your cholesterol level by just having a breakfast sandwich or something to eat. If you have some waffles or something like that, that's definitely going to change your blood sugar, and it's going to change. It could change your cholesterol if you have some bacon or something in it. And so you want to have a clear reading when you go get your physical. That's why they tell you don't eat, just drink water.
Right.
Yeah. So, all right. So you talked about blood sugar. Now there's these letters that we've been hearing, and I hear it on the commercials when they talk about the diabetic medicines. A1c. What is that?
Okay. So it's hemoglobin A1c. Now, everybody knows about hemoglobin, right? Hemoglobin is the molecule in your body that carries oxygen.
Okay.
right? So everybody knows that it's a hemoglobin that floats around and it carries oxygen to all the different parts of your body. Well, hemoglobin actually has different components. And there's an A and a B and a C, different components. And so it just so happens that the A1c component of the hemoglobin molecule actually attracts glucose.
Okay.
So if your blood sugar levels are high and you have a lot of circulating level of glucose in your blood, that glucose attaches to the A1c component of the hemoglobin molecule. Now, the hemoglobin molecule lasts for about 120 days, and then your bone marrow is making your red blood cells. So the hemoglobin and the red blood cell, they only last for about 4 months. So that test is a good test to tell me how you're doing over a 3 to 4 month period. So that's why they generally ask patients to test their hemoglobin A1c every 3 months. The good thing about A1c is that you can't cheat the test. So if you're doing a fasting blood sugar, you can be real good for a week and then go see your doctor and your blood sugar levels are pretty good. But hemoglobin A1c, you can't cheat it. So I know how you're doing, and I know what your sugars are, your average or mean levels are by looking at that test. So it's everybody, let me say that again, everybody that has diabetes needs to be getting an A1c test.
Okay. So we got your blood sugar, 60 to 100.
Right.
You got your hemoglobin A1c. That's a test you can't cheat, so you can't study. You got it. The way you get it down is by eating right. We're going to talk about that. We're going to talk about how we lower our blood sugar later on in the program. So stick around for that. But there is the hemoglobin A1c that the sugar likes to attach itself to, and so that's a kind of a test, and it clears out every 3 months or so.
Every 3 to 4 months, and the number should be 7 to 7.5%, so less than 8%. So when you go to your doctor and they do the test every 3 months, you're going to say, "What's my number?" And he needs to tell you a number that's less than 8, which we'd like you to be around 7%. Normal hemoglobin A1c is some 4 to about 5.8, depending upon the lab. Okay, so it's less than 6. So you need your number to be less than 8, as close to 7 as possible.
Okay. All right. And that's if you're diabetic.
That's if you have diabetes, yes.
You have diabetes, but if you don't have diabetes, that number should be lower. Okay.
4 to 5.8. Yeah, less than 6.
And that's why this is where I'm leading to, because I know there's a group of people that are called pre-diabetic.
Right.
And so that is somewhere. And so I already saw the question. There was a question in there. So what is that group of pre-diabetic, and why is that important to understand if you're pre-diabetic?
Okay.
Walking around.
All right. So we said that normal blood sugar is 60 to 100. You diagnose diabetes at 126 milligram per deciliter. So between 101 to 125 is considered to be pre-diabetes. Now, why is that important that you know if you have pre-diabetes? Because there's a huge amount of studies and data that clearly shows that during this time when you're in that pre-diabetes stage of 100 to 125, you're damaging your eyes, you're damaging your kidney, you're damaging your heart and your blood vessels. So that is why most people, when they walk in and get diagnosed with diabetes for the very first time, they already have some of the long-term complications of diabetes, which are eye disease, kidney disease, nerve disease.
Okay. Wow. So pre-diabetes, so you could be walking around pre-diabetes. So when you hear that number, if you hear 100 and you get your blood sugar tested, and your doctor comes back and says, "Oh, you're at 110," you're in that pre-diabetic range.
Right.
And so that means that you need to start taking some measures to lower your blood sugar level.
Yes.
before you cross over that 125 mark, which is the line of demarcation for being diagnosed with diabetes.
Yeah.
Okay. And how many people are walking around today that are pre-diabetic?
88 million. 88 million people have prediabetes, and diabetes we're in the high 30s, right? So so we're talking about millions of people in this country that either have diabetes or they have prediabetes. 88 million. And that means that if we don't get prediabetes under better control and actually start trying to reverse it. See, that's one of the things that there's very few things that medical things you can reverse.
Right.
But studies have shown that prediabetes, they can actually reverse and go back to normal glucose tolerance. They can go back to normal numbers by doing lifestyle changes, by watching what you eat, by losing your weight, and by getting your exercise. So lifestyle actually can decrease your risk of going on to develop diabetes by 58%.
So how is somebody's blood sugar measured? Do they have to do the whole blood draw, or can they just do it by a simple finger prick? And is this something that people can do at home? Can we buy our own testing kit to where we can test our blood sugar periodically? I know everybody doesn't have to do it on a regular basis, only the diabetics do. But if it's something that you want to just check on your own, is there a way to do it and check it at home?
Yeah. So there are something called blood glucose monitors. And these monitors are extremely accurate. They're easy to use. They take just a little bit of blood. You just prick your finger, and then they have strips that actually, get the blood into the strip. And that strip is in the meter. And then that meter does a chemical calculation of how much sugar is in your blood. From that tiny little bit of blood. It's amazing to me. I remember when the very first meters came out. I've been doing this for 40 years. And I was around when the very first meter came out. We used to have to wash it off with a water bottle. So we've come a long way. And now we have meters that store up to 300 readings in the memory. And we now have meters that have what they call Bluetooth technology, just like the Bluetooth wireless headphones you're using.
Right.
This meter has Bluetooth. And so when you actually prick your finger and do the blood test with the meter, your numbers go up into the cloud and then come back down into your cell phone, and you can see your numbers. You can see your patterns. You can see when you're high, when you're low, and then you can start changing and modifying your lifestyle so that you could do the things that, decrease your blood sugar.
Well, and that's wonderful news. And the reason why I'm asking that is because when we did our hypertension show, we talked about being able to do your own blood pressure checks at home, right? Because they've got blood pressure monitoring machines at home. Now we're talking about diabetes. You could do your own blood sugar test at home. So some of these things, because understanding this, and I'm going to stress this point over and over again, you only see your doctor maybe 4 times a year. Maybe more, but let's just say 4 times a year at a visit that might be less than an hour. So if we say 15 to 20 minutes, 4 times a year, that's a little over an hour. We'll call it an hour and a half that you actually get to see your doctor. The rest of that time, it's you monitoring your health. And so the more tools, the more ways you can monitor your health accurately on a daily basis, the better chance you have having a healthier life instead of just waiting. Oh, I got to go to the doctor. I haven't been feeling well. Well, you can check it. You can check your blood sugar. You can check your blood pressure. You can check all of that on your own, chart it, graph it at home. So when you go see your doctor, you can bring all that information with you. You got the Bluetooth technology. You say, well, doc, this is what my blood sugar has been for the past 30 days. Right. And they can see that, and then they can make a more informed decision and advise you, because that's what doctors are. They're advisors. And so the more information you can give them, the better advice you can get. So, her name is Dr. Lenore Coleman. I'm sorry. If you're just joining us, you are listening to one of the most prolific diabetic specialist in the country, Dr. Lenore Coleman. She has been here before. She is part of HOV Health, and we'll be putting her website up later on in the programming. And so we're talking about everything diabetes with Operation Life Back to Basics as part of our series here on blackdoctor.org. So, all right, so we've already talked about levels of blood. Are there different levels of diabetes? Is there so we talked about pre-diabetic, we talked about type 1 and type 2. Now that we've crossed over into diabetes, are there different levels? Because I know like in hypertension, there was levels of hypertension and obesity and being, there's different levels of weight gain. Are there different levels of diabetes once you've crossed over into the diabetic realm?
Yeah. So before we move on, though, I do have to give a little plug to my website, where I have something called the Village Store, and those meters that I was talking about that actually are Bluetooth, I actually have a meter that I really like that we sell on our website, at the Village Store. It's called the 4Care Advance, and it is one of those Bluetooth meters. And if you join our Village program and use that meter, then my pharmacist can actually help, and my dietitians can help you get your numbers under control. Diabetes is different than hypertension. Hypertension has just different stages: stage 1, stage 2, stage 3. With diabetes, it's not like that. It's more of a continuum. Really, with diabetes, you're just monitoring those numbers. So we want your blood sugar numbers. If you have diabetes, when you get up in the morning, we want your fasting blood sugar. That means that's before you have anything to eat. So when you first get up, no coffee, no nothing, okay? Mm-hmm. It's supposed to be 90 to 130 milligrams per deciliter. So first thing in the morning, 90 to 130 milligrams per deciliter. Throughout the day, I like my people to be around 160 milligrams per deciliter. So anytime you test your sugar, it needs to be no greater than 160 milligrams per deciliter. If you do those numbers, then that A1c is going to be less than 8%. Okay. Because the A1c is based upon an average of all of your highs and all of your lows. So it tells me that in a percentage calculation. So with diabetes, we want you to be, again, nothing greater than 160, first thing in the morning, 90 to 130. And when you first get diagnosed, that's what we call sort of early onset diabetes. So you're in the early stages. So okay. Not a lot of damage has been done. So we like to be very aggressive with the treatment of diabetes early on to get your numbers under tight control and as close to normal as possible. Because the data shows that if we do that in the first year of diagnosis, those patients tend to have fewer complications later in life. Okay.
And that was my next question. So once you're diagnosed with diabetes, let's say you cross over that 125, you got your hemoglobin A1c, that's over 8. And I think that's the number, right? That's the number, it's over 8. Your hemoglobin A1c is over 8. Your blood sugar level is over 125. You've been diagnosed with diabetes. Are you always going to be diabetic, or can you reverse that? Once you've crossed over that mark, are you always going to be diabetic, or can you reverse it back to the point where you can still have some sort of normal functioning?
Yeah, so it's kind of interesting. So we talked about pre-diabetes. So what we found in that big, huge NIH study is that by various methods, lifestyle, etc., a third of those patients went back to normal. A third of them stayed right where they were in that sort of pre-diabetes stage. But a third of them, the light switch went on and they crossed over into diabetes. Once you cross over, once that light switch has been turned on in your body, you can manage it, but it does not go away. Okay. So you can manage it with diet and exercise, and especially early on. I have had patients that have been diagnosed with diabetes and they lost, 40, 50 pounds and changed their eating habits and changed their lifestyle. And so they were able to control their blood sugar with diet and exercise. But you have diabetes because if you stop eating right, if you stop doing what you're supposed to be doing, then that blood sugar will go back up.
Okay. So it's similar to hypertension, that there's always going to be that hypertensive possibility, but it can be properly controlled and managed with diet and exercise, to where we can get you off of those words that we don't like to hear, which is medications. And so that's
Right.
kind of the next.
Nobody wants to hear those
Nobody
words.
wants to hear those words, especially when the doctor says, "Oh, we can put you on these medications." So we already had the question asked, what are the medications? Because I know there's multiple types of medications under the diabetic spectrum. So kind of give us the groupings of medications and then what they do with each group. Because I know some medications monitor blood sugar, but they also help you with weight, and some of them are better on your livers. So tell us a grouping of medications and what each group does to help us manage our diabetes.
Okay, so I've been at this for 40 years. And when I first got out of pharmacy school in 1979, what I had to work with were what they call first generation and second generation sulfonylureas. So for those of you out there who are as old as I, you remember chlorpropamide. You might have remembered tolazamide. Those were way back in the day. Now people in that category of sulfonylureas are on glyburide or glipizide. Those are the second generation sulfonylureas. I don't like those drugs. I think no one should take those drugs. And the reason I don't like them is because they lower your blood sugar whether it's high or not, which means they have a propensity to cause low blood sugar reactions. They cause hypoglycemia. They also cause you to gain weight. And I just got done saying that people with diabetes, what you have to do is try to lose weight,
right?
Not gain weight. So I don't like those sulfonylureas. I also don't like them because there's been some data, a few studies which have shown that if in fact you have a heart attack and you're on those drugs, the size of the infarct, the amount of damage that happens to the heart muscle during that heart attack is bigger when you're on those medicines. So I don't like those medicines. All right. So when people get diagnosed with diabetes, the drug I want them to start off with is metformin. Most every doctor starts you off with metformin. The only reason that you wouldn't get metformin is if you have kidney problems, kidney disease, because it's cleared through the kidneys. And if your kidneys aren't doing a good job, then you don't want to take metformin because it can cause some side effects like lactic acidosis, which can be severe. So, but if most people are fine, most everybody starts with metformin. Metformin basically works at the area of the liver.
Okay.
All right. So during the night, your liver produces glucose. That's what the liver does at night. So metformin stops that from happening. So when you wake up in the morning, your blood sugar is lower if you're on take your metformin in the evening. Okay. So that is the way that medication works. It works very, very well. It actually helps with a little bit of weight loss, not a lot, but at least you don't gain weight, right? And it tends not to cause low blood sugar reactions. After your blood sugar hasn't been controlled on that, and controlled means less than 8%, as close to 7 as possible. Okay. If we're not getting there with just metformin, then we're going to need to add on a drug. So now we have to figure out what we're going to add on. What we add on, it depends on who you are and what's going on with you and your other conditions. Okay. So if you have heart failure, or cardiovascular disease, one of the drugs that we really are starting to like a lot are called SGLT2 inhibitors. These are drugs like you've probably seen them on the commercials. So Jardiance, empagliflozin, right? They're all in flocin. So there's empagliflozin, there are erdagliflozin, they're all in with flocin. Okay. These drugs have been found to be a nice add-on to metformin, and they're really good for people who have cardiovascular disease. Okay? If you have weight issues, then the drugs that I like to add on is either DPP4 inhibitors, so dipeptidyl peptidase inhibitors, so DPP4, that's the easy way to remember it. They help you lose weight, and they are complementary to metformin. I really like GLP-1 injections. Now, you've seen those on the TV. Those are the ones where they have the Trulicity, where they have the once a week shot. Okay, so there's a whole class of those medications. Some of them are once a day, some of them are once a week. I like them because they really help decrease your hunger. So you're not hungry. So people tend to lose 10, 15 pounds if they're on these GLP-1 agonists. The downside is they're an injection, but the upside is they're a little injectable pen. You just dial in your number, and the needle is microfine, so you don't feel it. Trust me. Okay. So I really like those drugs. So those are the drugs that should be being used at this stage of the game. Either SGLT2s, DPP4s, or GLP-1.
Okay, so yeah, I'll make sure y'all write that part down. There's been a couple of comments that said that metformin has caused some stomach issues, some digestive issues, and so is there something that they can take as a replacement for metformin if they're having too many stomach issues with metformin? Yeah, so at the smaller doses, like 500 to about 1,000, you usually don't have the nausea, the diarrhea, the stomach. It also has a metallic taste in your mouth, kind of. Okay. Which also happens. But once you get up to that 1,500, 2,000 milligrams a day, it does cause diarrhea. Now, the good news is that there's some, if you look up sort of, what do I eat to stop diarrhea? If you add those foods to your diet, that'll help. Also, if you take it, if you instead of taking the whole tablet, you split it up and like take it in the morning, and in the evening, it also helps. The good news is that the diarrhea usually, as you continue to take it, goes away with time. But you can do some dietary stuff to be able to help with the diarrhea. Okay. So I'm gonna ask one question, then we're gonna move to foods and other things we can do to help lower our diabetes. So there's a question from Charmaine. So I'm gonna ask your question on Charmaine. What is diabetic ketoacidosis? Okay, all right. So the diabetic, you've heard of the keto diet? Okay, so everybody's all into the keto diet, right? So they're eating no carbs, they're eating a bunch of protein, and what they're basically doing is they're measuring their ketones. They basically are trying to throw their body into ketosis. Well, what ketosis is your fats breaks down. See, that's why they do the keto diet. You're trying to break down your fat cells. And when you break down your fat cells, it causes ketones to be spilled into the urine and then excreted. Okay. So in people with diabetes, one of the things that insulin does is it decreases the breakdown of fat. So insulin, when it's working correctly, right, keeps your fat cells from breaking down. But if the insulin is not working correctly, you can't get the sugar out of your blood into your cells, right, for energy. So your body starts to break down fat as an energy source. Okay. And by doing that, it causes ketoacidosis because ketones are acidic. Okay. And so that's why ketones can cause, if in high numbers, can cause acidosis. Now in the keto diet, you're not really breaking down that much. So the ketones aren't really gathering in the blood to cause that acidosis. But that's why I don't like the ketone diet. Okay. Because I don't think that you don't want to do that to your body. You don't want to send your body into different metabolic conditions. It's not healthy. Okay. Okay. So I hope that, Charmaine, that answers your question. If not, we can explain it. So I do want to get into the next level. So we talked about the medications. We answered that question about the medication groupings, and some are for help with heart. Some of them help with weight. Some of them are not daily, where you get the injection. And so if you're okay with needles and injections, that might be easier on the body. It's just a once a week type of injection versus the daily pills. So we got the medication. So what are some things that we can do naturally? So we know that we got to move. We know exercise is a part of everything. It's part of our healthy regimen. We understand whether you got hypertension, high cholesterol, asthma, anything, exercise is going to be attached to it. But what are some foods that we can eat on our own that will help lower our blood sugar levels?
Right. So, one of the really amazing things that we have now that we didn't used to have are food labels. There's a nutrition facts even on a Hershey's candy bar. You've never probably read it. If you did, you're not going to eat any more Hershey candy bars. Because if you see how much sugar and fat is in a Hershey's candy bar, it just takes all the fun out of it. So what you're trying to do is, if you have diabetes, all right, we are wanting you to really focus in on your carbohydrates, how much sugars and starches. So it's the carbohydrate on that food level, okay? So we're wanting you to not eat more than 60 grams of carbohydrate per meal, no more than 60. And we would like you to eat less than that. Some people want you to eat about 50 grams of carb in a meal. So 3 meals a day, and then you got your 3 snacks a day. Right. It's important to eat as often as possible, because otherwise your body stores everything you eat. So if you only eat 1 meal a day, that's not good, because your body's not going to burn that meal. But if you're eating 3 meals a day, your body knows some more food's coming, and so it burns up more efficiently that food you just ate. That is why we encourage 3 meals and then 3 snacks. The snacks need to be 100-calorie snacks. So you can just turn over the food label and look at the back of the package and see how many calories, and you want to be really close to 100. 110, 120 as a snack. All right. So people with diabetes can eat everything. Okay, but they have to eat it in small amounts. Probably you shouldn't eat Krispy Kreme donuts or donuts.
Ooh, boy, no.
You probably shouldn't have a whole quart of Haagen-Dazs ice cream or any other ice cream. Okay. Yeah. Those are, can you never have a donut ever again in life? And can you never have ice cream again? No, I'm not saying that. What I'm saying is, in a 7-day week, you need to try to be good, which means following some kind of a food plan 5 days a week. And then you can go ahead and splurge a little bit on the other 2 days. Knowing that if you eat things that are concentrated sweets, so ice cream, cookies, cakes, donuts, candy, those things will make your blood sugar go up.
Anything that's delicious.
Anything that's delicious. Yes. So that's the problem. But I still listen, I'm a chocoholic. I love my chocolate. Right. I still eat, a little bit of chocolate. I just eat a little bit though, right? So you have to just read your label, and you have to just factor it in. I said you could have 60 grams. So you just factor in your sweets into that 60 grams in each meal, right? And then maybe go out and take a little 20-minute walk after you've splurged a little bit, right? Okay. So you can burn off the calories, because it's all about calories in, calories out. And so as long as you're burning those calories out, then you're good. But if you're eating and you're sitting and you're not getting your 8,000 to 10,000 steps a day, then that's a problem.
Okay. So I got a couple questions from our comments. All right. So, and I take the gummies of this. So I'm curious as the answer to this one too. Does apple cider vinegar really help?
Of course, there have been no real clinical studies, right? Okay. But I actually think it helps. And only because I think that it decreases some of the insulin resistance. That's what it does. That's how it's working. Now, there's really been no clinical studies to show that, in fact, that does. But I do know that there are people that are on the apple cider vinegar diet, and they take a little bit of apple cider vinegar before every first thing in the morning. And I know there's that product that's out there, and it basically is a gummy, right? And it is apple cider vinegar. But you know what? Well, the interesting thing about all things that you take for weight loss and for diabetes, when you start using those products, you tend to also start not frying your food, air frying your food, baking your food, grilling your food. You also start eating a little bit less. You also start reading your labels. You also start drinking more water. You also start doing all of these other things. So it's hard to see if what this thing that you've added to your diet or your regimen really did the trick, or was it all the other stuff that you started to do as well?
In conjunction, because you're right, because one of the things I did, I bought the apple cider vinegar gummies, but what I also started doing was cutting down on my carb consumption at night. And so in my evening meals, I would try to eat some lean meat and mostly vegetables at night, because I know, and I learned from you, Dr. Colvin, that your liver produces blood sugar and all that stuff at night. And so I didn't want to add to it and just put all that carbs on my body. I'm sleeping and my body breaks down all that sugar. And once it gets through those complex carbohydrates, the rice and all those things are breads and all that stuff is, and your body says, well, you're asleep. What am I going to do? And it stores it as fat. And so that's how we gain weight, is when we eat a lot of those carbs at night and then go right to sleep. And I know that's what we want to do as we get full, but we got to lower the amount of carbs we eat, especially in the evenings, because you're less likely to go for that walk, you're less likely to go for that bike ride, you're less likely to go to the gym, and while you're sleeping, your body's going to store that as fat, and then that's how we gain weight. So we got to make sure. So you're right, because it has been a whole total lifestyle change versus just adding the apple cider vinegar.
Yeah.
All right, so that's the apple cider vinegar question. Dark chocolate. Can we eat dark chocolate?
Okay, so if you're going to eat chocolate, you should eat dark chocolate. Okay. And there's something called the Arthritis Diet. You know, I actually suffer from arthritis. I actually had two hip replacements. And so it's called the Anti-Inflammatory Diet. And if you pull that diet, it's Dr. Weil, W-E-I-L, his diet. If you pull that diet up, it's a pyramid and it tells you what you can eat. It looks pretty much like the food pyramid. The reason I like it is because it has dark chocolate, just a little bit, but you can have a little dark chocolate. It has red wine and it has green tea. Green tea is a great thing for you to drink because it has a lot of antioxidants, and antioxidants are good for your heart. So and that's why red wine is good for your heart. That's why wine is okay for you to drink. In fact, the people who live in the 5 blue zones across the world that live to be 100, almost all of those people have wine in their diet. Okay. Yeah. So the dark chocolate, if you gotta eat it, that's it.
It's an anti-inflammatory diet by Dr. Weil, W-E-I-L.
Yeah.
So make sure that if you want to look that up, it's called the Anti-Inflammatory Diet by Dr. Weil. And we already talked about this on previous programs. Inflammation is bad.
Inflammation is bad.
Inflammation is bad in your body. So that's how your body responds to any diseases, things like that. There's inflammation that happens. When we talked about asthma last week, we talked about inflammation of the brachial tubes and all this stuff. Inflammation narrows the airways, and that's how we have a reaction. Inflammation is bad, so we're trying to reduce the amount of inflammation in our bodies. So red wine is good in that. So because white wines typically are sweeter, have more sugars. So red wines are typically less sweet and have more of the antioxidants in them than white wines do. And so if you're trying to get the benefits of the red wine, you want that antioxidants because it's made with red grapes, and you get the antioxidant factor with the red wines versus the white wines. They're both still good, but red wines are better with regards to drinking. So another thing that I've heard, it hasn't brought up if I haven't seen a comment. What about cinnamon?
Okay. Yeah. I think there again been a couple small studies, but I do a lot of work in the Caribbean. All right. So they use a lot of stuff like, they're using their turmeric, which is the anti-inflammatory, they're using their cinnamon for their blood sugars. And I think that is probably a good idea. It needs to be the cinnamon sticks, right? You need as much of a concentrated cinnamon as possible. But if you just want to sprinkle the powder on your coffee or tea or one of your meals, those are good. But yeah, I use cinnamon. So I think cinnamon's good. I want to say one quick thing though, because of COVID-19, we're living and breathing COVID-19.
Right.
The reason why those folks with diabetes and hypertension and obesity died at a higher rates last year when they got COVID infection is because of the inflammation. And inflammation decreases your immune system.
Yes.
So that is why it's important to really boost your immune system by decreasing your inflammation.
Yes. Yes, absolutely. And because when you have inflammation, your immune system is already actively engaged in trying to deal with the inflammation that's in your body. And so when you add another illness on top of that, then your immune system becomes weakened and compromised, and it's not able to effectively treat the secondary illness, which is COVID or coronavirus. And then that's why you had those higher rates of mortality with people that had diabetes and hypertension and all these inflammation type illnesses, because the dual inflammation and it's overwhelming the system. And that's how you have the mortality rate. So we've got to lower our inflammation on our own. We talked about turmeric and cinnamon and red wine and dark chocolate and all of these foods, the anti-inflammatory diet. So get on that diet. Garlic is good. I don't know if it's anti-inflammatory, but it's very good in terms of circulation and your blood pressure. So there are a number of natural foods that we can eat that will help lower our blood sugar, that will help lower our blood pressure, and get us to a point where we're lowering the inflammation in our bodies. Exercise is good because it strengthens the heart and it keeps the blood pumping, flowing throughout our bodies. So I believe the recommendation is 150 minutes per week of elevated exercise. So just that stroll that you do is not enough. No, you have to do a brisk walk to elevate the heart rate 150 minutes per week.
Right. Exactly. And another thing to think about as it relates to the foods is fiber. So fiber is good. So trying to eat as much foods that are high in fiber. So making choices. So I eat the orange instead of drinking the orange juice, and I eat the apple instead of drinking the apple juice. And so anything that's got fiber in it also decreases your blood sugar. So there's something called the glycemic index of a food. And so we need to Google that, and folks can go out there. And so you want to eat things that have a high glycemic index. And so you want to try to avoid a low glycemic index. So again, those fibrous foods tend to be high glycemic foods, and that's what you want.
Absolutely, and then we learned about grains when we talk about cholesterol. We talk about grains like oatmeal, oats. That'll help pull that cholesterol out of you and clear out those blood vessels. So you can.
Yeah, it's really important. Yeah.
Diet is very important. What you eat is very important, and what you put in, because that's going to determine everything that happens that goes on in your body. And so I know some of those foods don't taste really, really good, but over time, just like you got used to eating all that sugar and all that salt that we put in our diet, because I think we're supposed to get less than 1,600 milligrams of salt per day. Yeah. And we talked about hypertension. So all that food, you over time, just do a little bit at a time, you will adjust to a healthier diet, and you'll start craving it more. As you start exercising and eating better, your body will say, oh, that's what I want. And you'll feel better, just like your body might be craving sugar and salt right now and potato chips and all those delicious snacks that we like to eat right now. I promise you, if you start eating healthier, your body will start craving that, and you will feel a lot better.
Yeah. Oh, yeah.
Exercise, definitely. Sleep are just as important as diet. Those three things together, sleep, diet, and exercise, will help you move to be healthier and get you to where you'll have you can monitor any health conditions that you have going on in your life. So, all right. So we talked about all this stuff. We talked about food. We talked about medication. We talked about what is diabetes. So we're going to give you the warning signs. What can happen if you have diabetes and it's poorly controlled? What can happen to a person?
Yeah. So just a quick on the symptoms. So we talk about the three P's. So polyuria, polydipsia, polyphagia. So people find out they have diabetes because they keep going to the bathroom a lot, and they get really hungry, and they have slow wound healing because again, your immune system's not working very good, but the complications of that high blood sugar is what I mentioned early on. So it's your eye disease, your kidney disease, and your nerve disease. Those are called the microvascular, the small vessel disease. And then the heart attacks, that's your big vessels, that's your macrovascular disease.
Mm-hmm.
The problem with people who are of African descent is they have hypertension and diabetes, which is a double hit. So that's why you see so many African Americans in dialysis centers have lost the function of their kidney. All of this is preventable. All of this is preventable. So it's really important that you always, especially if you have it in your family, that you keep a constant check on your blood sugar, especially when you start getting in those 40s, 50s, and 60s years of age, because that's usually when we see type 2 diabetes. And so you got to know your numbers. You got to know when you go to the doctor's office and they draw blood, you go back to see them, you need to have them print that lab report out for you, and you and him or her look at it together so you can see what your numbers are. Everybody's got to know their numbers. But like you said, you can do stuff at home. You can take your blood pressure at home. You can get your blood glucose monitor, take your blood sugar at home. There's even some over-the-counter cholesterol tests that you can get. So you can do a lot of stuff at home. And listen, you can get a scale. You can step on the scale. Wait, how about have some mirrors in your house? People who are overweight don't have mirrors in their house.
Right.
They don't want to see themselves. So every day, you need to put that mirror in your bedroom. And when you get up in the morning, you need to look at yourself with no clothes on.
Woo. Woo. All right. All right. Okay.
And if you don't like what you see, fix it.
You could definitely change it. So I think Wanda is making a good point. Lord, I need help. I have high blood pressure, diabetes, and a lot of inflammation. So Wanda, I will say this. First, go to your doctor, right? Your first step is go to your doctor and get where your baseline is. What are your numbers? Are you pre-diabetic? Are you diabetic? Are you suffering from some other type of inflammation? Get all that information to see what you can do. Second thing I would say is once you figure out what you can do in terms of movement and exercise, engage in those activities as much as possible. Okay, so if you've got some knee swelling or some damage to your knees that you can't do it, then there's exercises that you can do. If there's a pool, there's a lot of exercise you can do in water that can still get the heart benefits that aren't as strenuous on the knees. So there's exercises that you can do that could so start that movement. Then find the diet, whether it's the anti-inflammatory diet. We've talked about the DASH diet when we're talking about hypertension, and see where there's some connectivity between those two diets. And you've got to change what you eat, because what you're putting into your body is going to help. Is really going to help flush out a lot of the issues and lower some of those numbers that are getting too high, right? Because you can get your lower your HDL, your LDL numbers in terms of your cholesterol. There's foods you can eat for that. There's foods you can eat for your hypertension, and there's foods that you can eat to lower your blood sugar. And some of those foods are the same thing, right? So a lot of those foods are the same thing, same foods, right? So eat more fiber in your diet, eat less meat. Because your body, that liver that produces at night, we're talking with Dr. Coleman, that same liver produces cholesterol, right? That same liver. So you don't need to eat any cholesterol in your body. So every time you put a piece of meat in your body, you're adding to your cholesterol level. And so whether in a good way or a bad way. And so if you have high cholesterol, lower your meat content, increase your fiber intake, lower your blood, lower your sugar intake, because all that converts to cholesterol. So there are ways that you can get healthier without medication. Now, medications will help balance that out if it gets too high, but there are things that you can do and you can engage in every day between those doctor visits that'll lower all of those numbers.
Yep.
All right, so we talked about, so one of the things we had on here before, we had Dr. Fakaridi, and he is a heart doctor in Mississippi, and he talked about PAD and CAD, and I'm not even going to go through what those terms are because they're very, very fancy medical terms. It basically says this: diabetes can cause a blockage in your blood vessels at any place in your body, right? So normally what we hear about is in the heart, where we have heart attacks. You have too much blood sugar and it starts hardening up and you get those cholesterol and all that gets the heart attacks. Strokes. You have a blockage in the brain. That's what causes a stroke. If you start having blockage in your lower extremities, right, that is what leads to amputation, because what you can have is it can deaden where you don't feel, and you can give me the technical term there, Dr. Coleman, where it lowers the feeling in your lower extremities. And what is that with diabetics? They get it a lot.
Oh yeah, no, neuropathy. So this numbness, tingling, and you really you can't feel the sensation. A lot of times, diabetes causes amputations. Yes. And the reason why people get the amputations is because they maybe have stepped on a nail or stepped on something and they didn't feel it, and it stays there and it ends up getting infected. And so people with diabetes really need to go see their podiatrist at least once a year, just to make sure that their toenails are cut and their feet are in good shape.
Absolutely. And so if you don't take care of that, you just got that tingling feeling, whatever. And Black people have a disproportionate number of amputations, right? Because that's the easy way. And so you'll lose a limb. Yeah. And there are procedures that can be done to open up those blood vessels, yes, and get the blood flowing back into it. But a lot of times, so if your doctor, if you have that situation where you've got diabetic neuropathy and your doctor, you go to your doctor and doctor says, well, let's just go ahead and amputate that, I would suggest get a second opinion.
Yes. Right? Yes. I'm a firm believer in second opinions. Yeah.
Yes. Get a second opinion, because there's no, unless you get multiple doctors to say you have to lose that limb, don't just take the first doctor that says, let's cut the limb off, because
there's a lot of limb salvage is what you're talking about. So they do all these things to be able to open up those vessels, to be able to they do surgery that can bypass some of the blockage and be able to open things up so you can salvage those limbs. And we don't avail ourselves to those technologies. We have got to do a better job in taking care of ourselves and getting second opinion. I keep coming back to this COVID. This has been a very interesting year and a half, almost 2 years for me. I've been doing this for 40 years, and I have never seen a situation where people are not listening to healthcare providers, to what their doctors are saying. I don't get that. We study all our life to be able to do what we do. We read and we study and we know about these things, yet people are not believing what we're saying. It's really interesting. I've never seen anything like it.
Yeah, and it's really disheartening that people have tried to use it, and there's nothing wrong with using the internet, but go to your doctor. And again, your doctor is for advice, and then you can see a second opinion is just another piece of advice, and then that helps you make your decision, but it's your health decision. So as we're wrapping up here with Dr. Coleman, I want to let people know how they can get in contact with you, Dr. Coleman. So I know we have your website here. It's HOV Health. So my producer could put that. I think I put it earlier in the banner. So it's HOVhealth.com.
HOVhealth.com. Listen, on Monday nights, we stream our nutrition support groups. We're doing video Zoom classes, free. On Saturdays from 11 to 12, every Saturday, I'm doing my diabetes series called Sugar Busters. I'm live on my Facebook page and on my website. Yes. You all can call, ask questions. I'm right there. We're looking for folks to join. So we need to start having some watch parties so that folks will look at Sugar Busters and we can start trying to do something with diabetes. And then stay tuned, because shortly I'm going to come back and we're going to talk about my weight loss app called Step Up 90. So that's coming. It's almost ready. So
I'm excited about Step Up 90 because absolutely right. It is for diabetics and it's a weight loss app, and it gives you all the information, access to webinars and Zoom classes and and you have access to a direct medical professional that you can chat with and get anything that you need on Step Up 90. So we're excited about that app coming out. Make sure you go to hovhealth.com. Watch Sugar Busters. You can also find Sugar Busters. We've done some episodes, streamed some episodes here on blackdoctor.org. So you can always see it on our YouTube channel as well. Sugar Busters is a wonderful class. And everything we talked about today in 1 hour, it's multiple classes. And they take one time where there's a whole hour long on medication. There's a whole hour long on Black men and diabetes. This hour long. So Sugar Busters will get you everything you need to know about diabetes. So please go to HOV Health. Please check out Sugar Busters every Saturday, 11 to 12 a.m. with Dr. Coleman. Thank you on HOV Health. And again, I wanted to say thank you to Dr. Coleman for coming on. It's always a pleasure. As you can tell by the comments, you have been, again, you're a godsend in terms of getting people the information they need so they can be their own best health advocate.
I wanted to just throw in a couple things. So I said high glycemic foods. You need to be eating low glycemic foods. So I just want to make sure that they heard that right. So low foods that are low in the glycemic index. My 800 number is 800-788-0941. We're in Jonesboro, Georgia. We're here in the ATL. Please call us. We have a building in Jonesboro. You can come over and see us. We're still taking care of patients, even though COVID is affecting our community. So if you have a question, hit our website, subscribe, join our Facebook and Instagram pages. We're here for you.
Absolutely. Absolutely. And so are we. So if you want to get more information about diabetes, you can go to blackdoctor.org. We have a whole diabetes channel there dedicated. We'll have this video will be available on our Black Doctor Facebook page, as well as on our Black Doctor YouTube channel. We are going to re-air this program tomorrow morning. So if you have a friend that missed this program and you want to watch it again, if you want to get the information or tell a friend, we're going to re-air this program for you tomorrow morning so you can get this information out, because this is imperative. This is life-saving information. And I'm going to thank Dr. Coleman from HOV Health to coming to us and giving us this information tonight. So thank you so much. Please, please, please be safe, be healthy, and get well. Thank you, and have a good evening.
Thank you. Take care.